Greetings! Hi, I'm Dr. John Florendo, foremost brain chiropractic physician in the world. Thank you for having me at this virtual neurology summit. Thank you to Dr. Wade and the American Posture Institute for putting together this. I have been intrigued and inspired to talk about what I've been doing for the last 32 years. Practice goes fast. Life goes fast. We try to kind of take a little bit of each part of our time with in our practices and hopefully leave a legacy for people to learn from. And that's pretty much what I've been doing over the last 32 years, going on 33 years, is putting together data of my protocol. The Florendo Synchronized Healing Method is a protocol that I follow, and I've seen fantastic results with all the different types of conditions that come in through our doors. My background, I'm from New Jersey, born in New York, raised in New Jersey. My practice was in New Jersey, 25 years in New Jersey. Biggest practice in my county, Monmouth County, 125 people a day, 12 staff, 5 doctors, rocking and rolling, helping sick people get well, and doing what we need to do to help them, be able to function as close to 100% as possible. And a million spines later, right, with mission trips and practice and all the different types of services that my practice provided. I've been able to take a million spines, take the data from those million spines, and be able to put together a protocol that I believe will help and can help, especially chronic pain syndromes that are out there. So the clinical strategies for brain-based symptom pain relief of relieving pain is really what this program is about. I have also some shout outs for some of my mentors over the years that I've been able to and be blessed with training with and learning from. One of my very first mentors was Dr. Clay Thompson, and he, the inventor and developer of the Thompson technique. I was able to be tutored by him. And what a great experience that was. I have Thompson tables that I utilize in my practices, and they've been so instrumental with saving my wrists and my low back. Right, a lot of the chiropractors over time, we get a lot of wear and tear. So your table is your instrument, and I thank Dr. Thompson for putting together that table for us to utilize. I'd also like to thank Dr. Robert Boyd, doctor of osteopathy, who put together the findings and research for the biocranial therapy technique that I've been able to study under and learn from. He taught one. I was able to attend his classes where he still taught, which was so inspiring to see a gentleman, a doctor, help people in Ireland. And he had an unbelievable practice. I think they were seeing 2,000 people a week with a 6-month waiting list, right? That's the type of work that he did. I also would like to thank Dr. Michael Johnson and Dr. Frederick Herrick, who put together the chiropractic neurology diploma program, which I've learned so much in regards to how the brain functions and the neurology of chiropractic and how we can utilize that to help people get well. And last but not least, my mentor and confidant, Dr. John Demartini, the Demartini Institute, who has always kept me focused on value-driven practice, a value-driven practice, linking values. And he always says that to us, was that everyone that we come in contact with has a hierarchy of their values, right? Means that in their life, they have a list of what's important to them. Your hierarchy of value determine your life, right? And if you're out there in practice and you don't identify the value of your patient, the values of your patient, that could be the determining factor for success and not success with their treatment protocol, with their care plan, right? So if health isn't in the top 3, you'll probably have a hard time keeping them on their program. Okay, or they'll be symptom oriented. If you don't educate them, they're going to be symptom oriented and they're going to quit, right? And they're not going to get the complete care that they need. right? And I've noticed that in my practice is that, if we don't have them attend we call it a healthcare class, right? Yeah, we know about the healthcare class, the spinal orientation, new patient orientation, whatever you want to call it. If you don't educate them on what they're getting done or why they're getting it done, right? They have a better chance of not following through, right? So their values, you got to link their values to their care. That's one thing I've learned, and that's very important. The chronic pain cycle, my topic, clinical brain-based strategies for dealing with chronic pain. The chronic pain cycle is like the safety pin cycle, right? Those of us in chiropractic know, if you went to the class or read the book from Stevenson's chiropractic textbook, it talks about the safety pin cycle. Brain cell, tissue cell. Brain cell, tissue cell. If you don't have a connector, right? Think of a safety pin, how it's designed. You have a small head, big head, right? You have the wires that come along, they connect. Think of the big head as the brain cell. It sends a message down that outer covering or that outer wire into the smaller head of the safety pin, right? That's the pathway. Brain cell to tissue cell. The tissue cell sends a message back up the other pathway, the opposite side of the safety pin, right? The tissue cell to brain cell pathway, right? And that's also what happens in chronic pain. There's a cycle as well. That process, if you look at how the messages are sent from the brain, right, which I'll go over later on, I'll show you some slides of what that looks like. You have the cerebellum, right and left cerebellum. You have the frontal lobes, left and right frontal lobes, right? And there's a feedback loop that brings it right back down to the midbrain and the pons, right, which connects the whole system and how it relays messages, right? And if there's a loop, a break in that loop of message, you're going to have a signal. And what are signals? Symptoms. So are you symptom oriented or are you cause oriented? Do you want to correct the cause of the symptom or you want to just continue to treat the symptoms, right? And pain is a symptom. It's not the problem. So what's causing the pain is the true problem, right? And that's why we're looking to the nervous system for that, right? So my protocols, the major things that I look for in the Florendo Synchronized Healing Method, right, are outlined. There's 6 things that I will look for, right? And the 6 things I feel, after a million spines, 32 years of practice, I found that these are the most vital signs that the body's going to give, right? And you can really identify with some health issues in regards to just these signals, right? But the main thing, of course, is removing nervous system irritation, nerve blockage, nerve flow blockage, or subluxation, which is what we talk about. Subluxation, less light. Light is energy. There's no energy going through that nerve. You're not going to have proper healing, right? You're not going to have proper electricity, right? You have electricity traveling through a nerve at 287 miles an hour, very fast. And if there's a blockage, it's like almost a car stopped in the Holland Tunnel. Nothing can get through. A car stopped on a bridge. Nothing can cross over, right? And you've also got to have the proper crossover bridge, the synapse with neurotransmitters as well, which I'll go into. One of the things I look for protocol wise, right? So that's going to be the major focus of my program today. Main thing is also dealing with understanding that every patient that that comes through our doors, that we look at, we evaluate, has the innate ability to repair. Do you believe that? They do. They have the innate ability to repair. In osteopathy, they call it vital force. In chiropractic, we call it innate intelligence, right? That's what repairs us from the inside. Universal intelligence outside the body, innate intelligence inside the body. Stevenson's book talks about that, the chiropractic text. If we are not identifying that the body is what does the healing, that we're not the healers, right? We're always going to take sometimes credit when we don't need to, right? We're just the middlemen or middle women In removing the blockages, it's the body that does the healing. So innate intelligence, vital force, is what causes healing. Okay, I just wanted to get that across because, B.J. Palmer talks about it. Dr. Stills talks about it. That's important to understand. And we don't have that innate traveling at 100% or near 100%. We're going to have weakness. We want to make sure that we have the proper nerve flow and nerve tissue function in order to have the proper cellular function. Right, that's what I wanted to bring across. Right, but the main thing is this. In my healthcare class, I talk about the 6 facets of health. Right, you have posture, you have nutrition, you have sleep, you have positive mental attitude, you have balanced spine, optimum spine function. Right, you need those things to function and be healthy. Right, but you also need, in my protocol, you need to make sure that these protocols are also functioning as close to 100% as possible as well. Optimum levels, right? First one I look for is nerve flow. Nerve flow, right? I use a neurometer, old-fashioned neurometer. You should use surface EMG. You can use whatever you want to see which side is balanced or unbalanced. It could be from heat emission, it could be from spasm, it could be from different things. When I find my neurometer, when the numbers are being calculated on the meter, I mark where the high numbers are. If it stays 0, I leave it alone. If the high marks, I put a red mark with my red marker that I've had for 30 years as well on the spine. That dictates exactly where the air is up. And when I come up into the cervical spine, of course, as well, I'll make sure that I identify from 7 to occiput where there's hot spots along the spine. Right? Nerve flow, structure determines function. If you don't have proper structure, you're not going to have proper function. Nerve flow is a good indicator of that. Right? That's 1. 2, I'm going to also check for oxygen levels. Oxygen levels, right? Oxygen, right? Body needs 2 fuels, oxygen and glucose, right? If you're not having proper oxygen, how can the cells stay alive, right? I use just a simple pulse ox meter. Check both sides, right? 95 and above, optimum, within normal limits. Not below, we got problems, right? I try to identify if there's an issue in there. I've noticed that when they have, of course, and you've seen it too, they have COPD, they have other pulmonary issues, heart issues, you're going to have lower numbers, you may have unbalance as well, right? So I want to identify that, and because I will at times put them on a oxygen concentrator with glutathione if I need to, which comes in a blend that I can mix in the medicinal cup and use the oxygen concentrator and the humidifier so they can bring in the glutathione in the mist. They find that taking in pulmonarily, in the pulmonary system, the glutathione better than oral and injection. It circulates through the system much more effectively, right? That's if I see those numbers. And of course, if they also have some underlying issues like COPD or emphysema or things of that nature. Research shows that glutathione is a fantastic adjunct to the care that we provide. 1. So I'm going to be looking for that O2 count. I'm going to use that O2 as a third protocol, the O2 count, also to determine also sometimes blood flow. Along with my ortho neuro evaluation, I'll do Georgia Cerebral, I do Soto Hall, I'll do the vascular test for circulation in the arm when they turn their head and extend. I'll use those tests to determine circulation blood flow as well. And that O2 count, that pulse by the pulse ox, will give me an identify if there's some blood flow issues as well, right? Because blood carries oxygen through the protein hemoglobin, as you know, right? So if those numbers are low, there's chances are their blood flow is affected as well. So the third protocol is going to be their blood flow. The fourth is I'm going to check also their pH. I'm going to check their acid alkaline balancing and see where they are on the chart, right? Neutral 7, below 7 acidic, above alkalis. We want to be in that neutral 6.5 to 7.2 range in the pH factor. You can use pH strips to do that. They found that when we are acidic, and I've seen that with the patients when they're on medication, they have their diets are bad, nutrition-wise, right? They're going to be in the acid range, right? And when they're in the acid range, it's going to affect blood flow. How? When they're acidic, it causes red blood cells. If you ever looked under a dark field microscope and see an acidic blood read, you see the red blood cells all clumped together, coagulated, right? That's going to cause the blood to be thicker, right? Blood thickness, right, is going to slow down natural repair because blood carries nutrients as well, but it's also going to cause a backup in the circulatory system, right? So acid environment biochemistry is going to cause some circulatory issues. If you look under a microscope and see a blood value of being alkalized, you'll see the red blood cells move around. Blood's thinner, red blood cells moving around, bouncing off each other, right? That also happens under what we call scalar energy. If you've ever utilized scalar energy, it does the same thing. It keeps the blood cells moving. It keeps the blood thinner as well naturally. You don't have to be on Coumadin or whatever Lasix to do that. That stuff will kill you. And I have patients who unfortunately have passed as a result of that. So just identifying blood flow, right? One of the things I'm going to look for at times also is their neurotransmitter levels. Neurotransmitters, the bridge is for the synapse of the neurons, especially the neurons in the brain. The bridge is there's neurotransmitters, chemistry that allows those messages to connect. Right? If you have patients that are having neurological issues, they're having all kinds of other brain fog, they're having emotional issues, they're having all these different types of problems neurologically. Test their neurotransmitters. It's done through urine. See where they are, see where their serotonins are. I do a whole class on this on biochemistry, serotonin, dopamine, acetylcholine, GABA, all these norepinephrine, epinephrine, all these different neurotransmitters that the body produces. Right? They can get all out of whack, especially if the patient's been in a car accident where they hit the back of their head on the headrest, which happens 99% of the time if you hit from behind, right? So imagine that. Check their transmitters, check their neurotransmitters through urine. And at the same time, I'll check at times their hormones as well, right? So transmitters, number 4, hormones, number 5, right? See exactly what their hormone levels are. Especially when you have a patient that, again, they're in chronic pain, they can't function, they're fatigued, they can't eat, they've got brain fog, they just feel they've got digestive issues, they've got all these other factors that are coming into their system. All these problems are starting to surface. Again, symptoms, right? Symptoms, signs. Let's find the cause. Right, let's find the cause of that. To check their transmitter, check their hormones. And last but not least, I also want to make sure that I'm going to evaluate their posture, especially their cranial posture, right? Their cranial posture. What's going on with their parietal bone, with their temporal bone? Look at them. Have them. What their zygomatic bones are doing, what their mandibles doing, right? If they're in translation, if they're negative Z position, where they're off center on their axis. Right? Identify that. That's vital. That tells us a lot what's going on. Remember, Dr. Boyd talked a lot about this in his book, Biocranial Therapy, Introduction to Biocranial Therapy. He talked a lot about what happens to the cranium during a couple things. One, birth, especially forceps delivery. Right? I mean, my son, who is 40 years old now, 40 plus years old, right? Was a forceps delivery baby, and he still actually has marks on his temporal area, and then caused an infection, and he's deaf, right? So firsthand, I've seen that can occur, right? Cranium, subluxation, fall, like I talked about, car accident, hit the head, right? Birth process. All these cranial traumas that never get corrected. Right? Just think about that. Vacuum delivery. They come out of a cone head, right? These sutures, they don't reconnect, and then they're subluxed. There's lesions in there, right? That starts to affect the inner lining, the covering around the brain, right? The pia mater, the arachnoid membrane, the dura mater. All those start to get irritated, inflamed, and shut down. And then when that starts to be affected, it prevents the flexion and contraction, the extension and flexion, the opening and closing of the cranium. Right? The cranium is what moves as it moves. It's sucking in, pushing out, sucking in, pushing out, moving CSF. Cerebral spinal fluid. What is cerebral spinal fluid? Cerebral spinal fluid is it's nutrients for the nervous system, especially the brain, parts of the medulla oblongata, the brainstem, right? That's nutrients that goes all the way down into the cord. 1. 2, it's a protective cushion for the brain, cerebral spinal fluid. But most importantly, cerebral spinal fluid also is the detox apparatus for brain matter. Right? Garbage in, garbage out. You got to get rid of some of the toxins in the system, right? The cerebral spinal fluid helps that process, right? So, those 6 things I talked about, those 6 protocols is what I look for, right? Now, how can you determine CSF flow? Again, cranial subluxation or lesions there's going to be an improper movement of the cranium. Right, the cranial sutures, how they move and expand and contract. Right, that's going to be one of your signs. As part of my protocol, I'll do the biocranial therapy on patients just as part of their initiation before we start to adjust the overfiring side of the brain. Right, which I'll get into next. Right, but just think about that. Those protocols are vital because they can start to identify where the problems are. Right now, tissue cell, brain cell, tissue cell. That diagram, right? The other diagram shows the cycle of messages being sent within the brain. Right? You have the left and right frontal lobe. You have the cerebellum, left and right cerebellum. You have the pons. You have the midbrain. Right? And that cycle works like this. Right cerebellum sends messages up. Cerebellum takes the information from the environment and realizes what messages are being sent to the frontal lobes. The frontal lobe picks up that messages, reconfigures, and sends messages down to the lower brain, right? And that tells the body what to do. So the system is when the cerebellum can be overfiring, right? So normally it's doing this. But overfiring, one side overfires, it starts to kind of malfunction the message and it shuts down, right? And that may cause signs of spasm and maybe a decrease in movement and maybe all kinds of different restrictions and in motor and sensory, right? So here's how it works. The motor cortex sends messages to the cerebellum via the pons. Okay, so the pons sends messages to the cerebellum, right? The cerebellum receives sensory input from proprioceptors in the nervous system via the medulla. Okay, so you get input from proprioceptors back to the cerebellum by the medulla, sent from the medulla. Now, the cerebellar cortex calculates a plan of action for movement. So the cerebellar cortex sends a plan of action for movement. The cerebellum sends a blueprint for action to the cerebral cortex via the midbrain and cerebrum, and further function for sensory and motor movement, for sensory reaction and motor movement. Okay, so that process happens instantly, okay, unless there is a problem in one of those message centers, right? So if you identify the side that's overfiring, you can shut it down, right? So in chiropractic school, they teach us how to adjust, right? And if you attended all the classes, they also teach you when not to, right? I feel, and I've had a number of associates, and we get out of school sometimes, and we just want to move every bone in the body. I was like that myself, right? One, it's not practical. Right, because with every action there is an immediate reaction. You've heard that, right? Keep it simple, KISS, right? Keep it simple. Keep it simple. Find the subluxation. KISS. Keep it simple. Find the subluxation, right? The subluxation will be the determining factor of how that nerve is going to function and how it's going to be able to send messages to the body to heal. So if you don't have proper nerve flow, nerve action, nerve function, your body can't repair, right? And you can adjust the compensations and you can move and manipulate the compensations, but if you don't correct the subluxation, right, the patient can't get better. Do you follow? That's really what I want to get across. Right now, in adjusting and in stimulating, like I said, what I'll do is I'll do a biocranial therapy, left side, right side, let them settle down, let the CSF flow and settle down. Right, then I'll go in with and identifying the overfiring side. Now you could do that with the protocol I followed, the low sides. You can also do that with when you're checking for muscular spasm on one side. Of course, they're going to identify where their pain or symptoms are on the one side as well, right? So that's the side that's getting overstimulation. So you most likely want to go to the opposite side to adjust, right, and stimulate. I use the ArthroStim. But I'm using for many years, and it's sit up on that high up on that. Atlas, the cerebellum is at the base of the occiput inside, so you can stimulate the cranium right in that area. And then, of course, if they have any underlying subluxations in the thoracic or in the sacrum area, pelvic area, go in and correct those too. That's kind of how I approach a patient. So I'll again, biocranial work, ArthroStim stimulation. If they have a sacrum, pelvic, lower spine issue, correct that. I use drop Thompson work for that. And I've seen with patients that have been acute, if I put them also before we start to stimulate the cerebrospinal fluid and shut down the overfiring side, I'll put them on oxygen, on the oxygen concentrator for a good 10-15 minutes, get O2 in their system, right, and then go in and help the body do what it needs to do, and that's repair, right? So those are my protocols that I follow, and I've been blessed to see that work with a lot of conditions, and I just thank God that I do what I love and love what I do, and continue to do it, and will continue to do it, and it's my life, and I owe everything that I have to chiropractic and the chiropractic neurology program. Putting the neurology behind the chiropractic and linking the two, and being able to present what I feel can be a major contributor to a lot of health condition, helping sick people get well, and helping healthy people stay healthy, right? My practice and myself, we're dedicated to the universal improvement of health. That's what we've been preaching over these years, and I just love what I do and do what I love. Again, I hope this has been helpful for a lot of you out there. And if you have any questions, you can email me, unlimitedwellness@gmail. I have on the page, I have a free downloadable book. I have 5 books that I've written. This one is one of my first. It's Keys to Vital Health. It's for now a free download, so take advantage of it. And I look forward to seeing you or reaching out. If you have any questions, reach out to me, and we'll see you on the next virtual summit. Have a great day, and thank you again.